First, live, local. This is Fox 12 Now.
Hello, everyone. Welcome to Fox 12 Now. I'm Greg Nibbler. I wanted to start off on this shot. That is a live picture right there from Lincoln City, from our Chinook Winds camera, and I just want to show it because if you're heading out to the coast, it looks amazing out there right now. Thank you for joining us. As I mentioned, this is Fox 12 Now. We live stream here every weekday starting at 1 p.m. Pacific. We're on Facebook, we're on YouTube, we're on our website, we're on our apps, so a lot of different places to find the segments and topics that we get to cover, and I appreciate all of you joining us. Feel free to leave your comments if you're on social media as we go throughout this segment. But what we're talking about today is it's National Wear Red Day, and that is to help promote heart health awareness. And we're going to talk all about that right now. And joining us from the American Heart Association, we have Heidi Stewart and Dr. Lori Tam. And thank you both very much for being here today. Appreciate you joining us. And there's so much to get into here, both with you, both personally, but also just to bring awareness and let people know about what this is. So I think to start off, and I'm not sure who wants to go first, can we talk about what National Wear Red Day is and what really the promotion's all about?
So, National Wear Red Day really is just a day to kind of come together and bring awareness to the importance of acknowledging heart disease and the great risk it poses to all of us, actually, in the community. Heart disease is the #1 killer of both men and women in the United States. I think, we often think of heart disease as a man's disease, but in reality, it's a woman's disease. 1 in 3 women will die from cardiovascular disease. It's a staggering statistic.
That's a huge statistic. I mean, my gosh. And that's a lot of what this is too, is bringing awareness to that, of women who have these issues as well, cardiovascular disease, and making sure that everybody's aware of that. And Heidi, thank you also for joining us here. And could you tell us just a little bit about what you do with the American Heart Association and what this day, really is all about?
Yeah, absolutely. Thank you for asking, Greg. So, this day also really encompasses women of all ages and bringing awareness to this disease and how it really does not distinguish between ages, nor does it distinguish between genders. This is something that affects everybody of all ages. We've seen it with Damar Hamlin. We've seen it, with Marcus, Michael Jordan's son. And I know when I was 18 years old, I was an extreme athlete myself, being a swimmer, and I actually ended up having a cardiac arrest at my high school, which actually ended up being to my benefit, as that's where I was saved by CPR and an AED.
I mean, that seems, so young. And being an athlete, you would think, okay, that couldn't happen like that, but it did. And I'm so glad you're okay, and so glad you made it through. And this, ended up helping you out, I guess, finding out then. But, that's got to be such a scary thing. And there's a lot of people out there. You mentioned Damar Hamlin, another great example that was very public, very visible. Somebody in great shape, but didn't know that they had these issues. So what do you think are some of the things that people should do to, I guess get checkups or walk through the physical side of things to make sure that they're okay, or they're not at risk of this happening?
Yeah, that's a great question. And it's something I get asked a lot. Now as the Go Red for Women director for the American Heart Association, I really specialize in being able to point people in the direction, but also advocate for them and with them that you really need to just listen to your body. I know that that's easier said than done because our bodies tell us a lot of things all the time. And, it's often difficult to really pinpoint exactly what's going on beneath the surface. But ultimately, what we're looking for is when you feel something that's out of your norm, when numbers look different, when you're at the doctor's office, whatever the case may be, that you really are paying attention to what your body's trying to tell you. That's really what I'm telling people the most. Also, making sure that if you are feeling that way, that you're getting the proper tests done, that you're taking the proper and necessary steps to, meet with those professionals and have those things looked into and researched.
To go a little further on that, because I think that's really important just to think about that, listening to your own body. Are there some key things that you can look out for when you're trying to make sure that you're feeling all right? I mean, beyond just, okay, I'm just a little bit tired today, but are there key things that maybe you should notice that if you are feeling in your body that you should go get checked out?
Yeah, absolutely. I'll touch on that and then I'll let Dr. Lori Tam highlight a few others in her professional experience. But I know for me, in my situation, I was dealing with a lot of extreme fatigue, extreme exhaustion. And as a senior in high school, it was really hard to differentiate between whether that was just me and my own personal bandwidth, not being able to keep up, or whether that was exhaustion from being an extreme athlete. But I also know that with me as a woman and a young woman at that age, I was dealing with a lot of stomach pain, stomach issues, which is something that actually we're seeing more and more young women dealing with these days. So it's very hard to differentiate between some things, and that's where you really just need to pay attention and ask the critical questions when you do meet with your physician.
And Doctor, would you
Well,
like to
I
follow up on that? Yeah, sorry.
Yeah, well, I'll say, nearly 45% of women over age 20 actually live with some form of cardiovascular disease. Many of them actually don't know it. So I think it's really important to make sure you're proactive, that you're getting your regular wellness checks with your physician, but also to, really know what your numbers are and what they should be. So know your numbers really are the key personal health indicators of your risk for cardiovascular health. And this includes know what your cholesterol is, your blood sugar is, what a healthy body weight, body mass index is, and what your blood sugar is. Those things can be checked annually with your visits. But I think a lot of people don't know their numbers. And if you don't, and if they do, they need to know what their numbers should be and work with their doctor to figure out kind of how do they get their numbers to those desired goals.
And that's something checking annually would probably be enough to do, or should you do that more often than that?
At least annually. And I think if it's abnormal, your physician will make recommendations as to more regular screening and follow-up of it to make sure that those numbers are within range. I will also say symptoms of heart disease can present very differently in women. Men often are more likely to have classic heart attack symptoms, which is some sort of chest pain, chest discomfort. Women sometimes don't present with the classical chest pain symptoms. It could be chest pain. Some sort of chest discomfort is still the most common symptom when a woman presents with a heart attack. A woman presents with a heart attack, but a lot of women will describe it as a tightness or a heaviness or a pressure or a burning. Many times it gets mistaken for heartburn. So I would say that if there's some discomfort in the chest that is not your usual, and especially if it gets worse with exertional activity, if exercise makes it worse, that makes it more concerning that it might be cardiac. Women often present with shortness of breath. Sometimes that's their major presenting symptom of a heart attack. Sometimes it's nausea, cold sweats, diaphoresis. Some people will say it's kind of an impending sense of doom. I know something was wrong. So, I think that, to Heidi's point, it's really important to pay attention to how you feel. If something doesn't feel right, get it checked out, because I think being proactive is probably the best thing you can do in terms of advocating for your own heart health.
This is a really good advice for everybody out there, but as you mentioned, particularly for women, to know that some of those symptoms could be different than what men are experiencing, and just to be aware that this is such an issue for everybody across the board. Looking at it from, and feel free to jump in if there's something else that you want to share, because I'm learning as we're going through this as well. But one thing I did want to ask is, obviously go in if you're seeing these symptoms, is what we're learning about. What are some preventative measures that you can do just as part of an active lifestyle to help make sure that you have a healthy cardiovascular system?
Well, I think that it's very important to be active. We know that 80% of heart disease is preventable. There are certain cases like Heidi's which are not. There are genetic factors and conditions that can come into play. But for a number of us, the majority of heart disease can be prevented by how we live, what we eat, the things that we do. So the American Heart Association recommends, maintaining moderate physical activity, at least 150 minutes per week, and a healthy, well-balanced diet. Usually it's a diet that has less processed foods, more lean protein, complex carbohydrates rather than simple carbohydrates. We know that simple sugars increase blood sugar, increases cardiac risk, and lots of fruits and vegetables. So I think that in general, the way that we live does impact our potential risk down the road.
What are some, well, I guess, Heidi, I want to go back to talking about what you went through with that, and you had that experience, and you mentioned that it did change your life, clearly in so many different ways. Can you talk about what that was like after you experienced that moment, and then going forward with your life from there?
Yeah, it's a complicated answer in that there were so many different layers and levels to that for me. I think initially when I first woke up and gained consciousness in the hospital, and really realized what had happened to me, I think my first instinct was, I have the second chance to be able to save the lives of so many other young athletes, and I'm going to use that opportunity. And, Greg, that's exactly what I did. I decided going into college that I was really going to focus on my degree in communication and making it so that I would be able to stand on platforms such as these, even today, to be able to share my story and advocate for others who either don't want to or maybe don't have the power to or are no longer with us today, and their story needs to be shared. There were a lot of local families that were really powerful and impactful for me during my recovery process, and still today inspire me. And they really launched me into the Go Red for Women campaign, where I was able to be a national spokesperson for the Go Red for Women campaign in 2017, and then was also a intern for the American Heart Association during my college years, and have managed to go through the transplant and donation community as for 5 years with them, which showed me a lot as to what exactly heart failure patients go through, heart recipients, what that whole world looks like. And then now, of course, being the director for Go Red for Women with the American Heart Association, I have this amazing opportunity to highlight and share and empower the stories and the lives of other women who either are living with something that is heart disease related today, or they've had a stroke, or maybe they don't even know it yet, but somebody else in their life has been impacted by heart disease. And that is the greatest gift of all, is that I've been able to receive this opportunity with my own story, propelling me through this today.
I mean, I think that's incredible that you had that moment and you decided that you wanted to help and share the message, and that's what you've done with your life. I mean, that's what you're out here doing, as you mentioned. And to that extent, let's talk about that just a little bit more in the Wear Red for Women, campaign. What is one of the biggest things that you want people to know about the campaign?
Yeah, the biggest thing I want people to know about the campaign is that it's for every woman everywhere. We really stand to come together and support one another, and also highlight and exemplify communities that are underserved. So there are a lot of communities out there with women who are still not being recognized in the ways in which they should. And I really stand to commit towards a lot of improvement in those areas. What that looks like is complicated, but at the end of the day, I think it comes down to advocating for those women, letting them know the resources that they have available to them, and making it possible for them to get the care that they need and that is equitable.
To that extent too, just to continue on that, talking about letting people know what the resources are. Obviously, things like this, we'll get the word out, but what can people do at home, that want to help, that are understanding that this is an issue, and maybe they're in a community where there's not a lot of education about it or not a lot of communication regarding these things? What can they do to help spread the words in their own communities?
Yeah, my first answer immediately is the American Heart Association's website. There you're able to, it's truly a major hub and resource for all communities in the area. You can find local clinics, you can find, things that are nearby that you can turn to. Also on there, we highlight ways in which you can learn CPR, hands-only CPR. That saves lives. It saved my life. You can find ways in which you can donate to our causes, which there are a multitude of. We have several pillars in our communities that we stand for, all which impact several different areas, including but not limited to, of course, women's heart health, tobacco and vape usage, and the list goes on and on. So truly, we have everything you need to know at www.heart.org. And from there, like I said, you're able to find your local market and go from there.
So everybody out there, share that with people in your life. I mean, because again, going back to that statistic, I mean, that's pretty much, it seems like pretty much everyone is either going to have to be affected by this issue personally or someone that they know. This is that it's that important. And Doctor, what else would you want people to know, who are out there watching right now? What else do you think is very important for people to know about heart health?
Yeah, I think a lot of people don't realize the heart disease is actually a big cause of death in younger women too. For example, we think of heart disease as something we get as people get older, but heart disease is the number one killer of new moms in this country. It's the leading cause of maternal mortality. I mean, that's a huge statistic. And we know that women who develop heart pregnancy related conditions, such as gestational diabetes, preeclampsia, gestational hypertension, even delivering your baby preterm or a baby that's small for gestational age, that increases her risk of cardiovascular disease at least twofold later on in life. So you're actually able to identify a group of women who are at much higher risk much earlier. And wouldn't it be amazing if you reached to that group and you gave them education, you were focused on prevention, because that group is going to be at significantly higher risk. You can target them and work with them much earlier so that they can empower themselves with these lifestyle measures and also preventative measures to really prevent heart disease later on in life.
I had no idea. That's wow. That is really is just so shocking that it's for those mothers, what they're going through and what could happen there. Something else, just to ask just about this, just to really, and I appreciate both of your times. Ideally, we've got, take care of yourself physically, watch out for issues, have a balanced diet. Is there anything else that we could do either as a community or a society to help mitigate some of these issues and some of these concerns that happen with cardiovascular disease and heart issues?
Well, I mean, I think that's a key. Actually, American Heart Association has done a lot of advocacy in terms of that aspect over the years, just in terms of making sure that we have healthy lunches in our schools and that we're stocking our grocery stores with foods that don't have trans fats. There are community-wide, population-wide measures that we can adopt to make sure that everyone is healthier, and these are one of those things. But making sure people have access to health care, making sure that people have access to healthy food, to an environment that actually promotes wellness all the way around. Childhood obesity is a big issue. It's a big issue in our country, and it's going to contribute to higher rates of cardiovascular disease as these kids get older. But I think there are great programs, headed up by the American Heart Association as well as other local communities where we are hoping to turn some of these things around.
Well, I appreciate both of you, for being here today with us, but also just for everything that you do for this. And, I appreciate your time. Is there anything else that you would like to add here just to get out here as we wrap up this segment?
Yeah, I would love to add, as a patient, a survivor, and now an American Go Red, sorry, the American Heart Association employee. I would love to add to just encourage people to do their research. So definitely look into the different kinds of tests that you can have done at a physician's office and in your cardiovascular care unit. These are the kinds of things that a lot of people are not always aware of, and I frequently get asked about is what test should I be asking for? And again, I just encourage people to do your research. When it comes to nutrition security, look at what resources are around you. That is one of the main pillars in which the American Heart Association here locally has really invested a lot of time and money and efforts into making sure that we have those sustainable resources for our community members. Look for ways in which you can help, get involved, volunteer, host CPR training, all the above. Do your research.
And these are all things that you can find out more about at the website. Is that correct?
Yes, you can.
Perfect. So, and let's give everybody the website just one more time.
Yeah, that's www.heart.org.
It's a good one to remember, and luckily an easy one to remember as well. So a lot of information there, a lot of ways to go there to just protect yourself, and as you mentioned, help out the community, and lots of ways to get involved. Well, both of you, again, thank you very much for joining us today. Really, really appreciate you being here and all that you do, and thanks for sharing your stories and helping to get the word out for everybody out there, and today, especially to women, to know about some of these cardiovascular issues that could be affecting them. Thank you both for being here on Fox 12 Now.
My honor. Thank you, Greg.
Sure.
You bet. And for everybody watching, again, appreciate you being here. This is Fox 12 Now. We live stream here every weekday. We cover a wide range of topics, segments, issues, many different things that we discuss on here. So thank you for joining us. I would recommend, too, you can share this episode. It's going to be up on the website. It'll be on our apps. It'll also be on Facebook and YouTube. So share that and just get the word out as far as letting people know about some of the avenues that they can seek to make sure that they are healthy, to watch out for some of those issues, and to help others out as well. We're going to sign off for right now. I'll be over on the website and the apps, so if you have the app downloaded, I'll continue the show over there. You'll see the Facebook and YouTube videos end. Coming up at 1:30, we'll switch gears. I'm going to be talking to Jennifer Nettles. You may know her as Amy Lee Gemstone from the Righteous Gemstones. So we're going to be discussing some things with her. That's coming up at 1:30, but I'll sign off for now. I'll talk to you soon. I'm Greg Nibbler. This is Fox 12 Now.